Hi everyone, welcome again to Empowering New Nurses show. I'm Dr. Miriam Smith, your host for this show. I'm excited that you came out. I'm excited that you have started following and the information that you have received that you will share. My young nurses, my new nurses, my seasoned nurses, documentation is important. The question today is nursing documentation important? With a resounding yes, it's critically important. Now, the documentation ought to be clear, accurate, and accessible. This will ensure that the patient receives safe, high-quality, evidence-based care, which all patients deserve. You will agree with me. Documentation is important in every category, all categories that you can think of, from the bedside to administration. Faculty, it's important to document. Why is this so important? Now we have different disciplines that care for the patient, and our documentation should be also aligned, and it can be integrated so that the patient receives the best care. That is the highest quality care that every patient deserves. Now let's think about why it's so important. We're thinking of accreditation. For credentialing, when we think of the legal aspect also, if something happens and nothing is documented, what will happen? Think about it. So for legal cases, also, if you don't have the documentation, wow, it can be sad. Therefore, my nurses, you need to document as you go along. Think about the regulatory agencies, the Joint Commission, CMS, and all of those. Remember, documentation. Think about reimbursement also. If you don't, how will you get paid for if you don't document properly or adequately? Research. The healthcare is always evolving and experimenting, and research for the information for the clinical to work with constant research as we grow in the sciences, and of course evidence-based practices. So research, and our documentation is on the electronic health records. Remember, back in my time, back in the days, way back, we used to have our paper records. Now, information would have to be transferred at other forms, maybe copies and so forth, to be sent. But now we have the electronic health records, which most hospitals and most healthcare institutions are utilizing, because with your permission, say for example in New York, some tests were done on a patient and recorded here. The patient goes to another state, becomes sick or so, that information can be transferred with their permission, and the care can be given, can be updated. We can avoid repetitions of some of the tests, blood drawing or an x-ray or so forth, a diagnostic test. The report will be given to the appropriate individuals, caregivers, and so that the care can be continued, some consistency, all right, and continuity of care. So that's very, very important. So my nurses, as you go from day to day and as you care for your patient, just remember, document as you go. If you don't document and you did it, it's as if you never did it, because there's no record to show. So record documentation is critically important in nursing, and of course in other areas of the interprofessional team. It's important because together with all the disciplines and the interprofessional teams coming together and working for the good of that patient, then the outcome will definitely be realized and should be so better than only an isolated case. So person or team. So we need the entire team serving with the patient in the middle, patient-centered care. This is important and this ought to be done. So my nurses, remember as you go, document as you go. In the event you didn't document at the same time, immediately after you've done, remember to document. If it's not documented, it's not done, and you'll be in trouble. So we don't want that. We want things to flow, and our patient, our families, the interprofessional team, and everyone do their best for the good of the patient. Thank you for listening. These just a few tidbits as reminders so that the patient can receive and will receive the best high quality evidence-based care. I'm Dr. Miriam Smith, the host of Empowering You Nurses show, and you can connect with me on YouTube at Miriam Amanda Smith, on Podcast Mir Instagram, on PodPal Miriam Smith, and Facebook Miriam Smith. Thanks for watching. Share it with someone. Subscribe, comment. And if you have any question or if you want us to address another topic, please do make a comment. I appreciate you. Thank you.